flu and COVID are different in a number of ways. First of all, influenza tends to spread faster than COVID does. Influenza, it usually takes 2-3 days between being infected and falling sick. With COVID, that takes 5 to 6 days. So the period between actually getting infected and falling sick is shorter with influenza and a bit longer with COVID, which means that influenza will also spread much faster than COVID does. A second difference is that we know that in influenza, a lot of the transmission actually happens even before people fall sick. In COVID, that also happens, but a lot of the transmission actually happens when people are already sick. So there's a second way that the disease actually behaves a bit differently. The role of children is also different in the two diseases. As we all know, in influenza, children are very easily falling sick because of flu. We know that. But with COVID, the role of children is not yet well understood. We know that children are not falling really ill of COVID, but we don't really know what is their role in transmitting the disease. But we see hardly any children actually seriously ill because of COVID. While for flu, children are certainly often very sick. Another difference is the severity of the disease. What we see is that in COVID, the people who can get very, very seriously sick. We know that 80% of COVID patients are actually very mild sick, but 20% are severe sick. In the flu, the proportion of people falling severely ill is much lower. And then also the age groups is different. In COVID, old people are very often very severely sick, and that is also the case for flu. But in flu, also pregnant mothers, for example, and children are particularly at risk, while in COVID, they seem to be much less at risk. So, whereas if you look at it from a symptoms point of view, that means when people fall sick and they show symptoms, they have fever, they have pains, etc., it may look like the same. The two diseases are actually quite different in a number of ways. We don't know yet what proportion of people who fall sick with COVID are dying compared to flu, to influenza, but it looks like it is substantially higher than with flu as well.